Hi guys, this one is on the difference between mini abdominoplasty and a formal abdominoplasty or a tummy tuck. So what is this difference all about? So in a mini abdominoplasty, if the patient has a good muscle tone underneath, then you need not go up above the navel in the dissection. So the dissection level of dissection differentiates the mini abdominoplasty from a formal abdominoplasty. In a formal abdominoplasty, the dissection will be right up to the panicles, or the tummy fat will be raised as a flap. It will go through. We will settle the navel, stick it out through separate skin. That means there will be a scar around the navel, as well as a longer scar in the line of the underwear, and that will go from bone to bone in a formal abdominoplasty, wherein we want to do the tummy tuck or the tuck between the separated muscles from the midline. With advancing age and repeated childbirths, we try to bring it down, bring it to the midline. For that to happen, we have to go up to the extent of the lower end of the rib cage. In mini abdominoplasty, of course, both can be very well done with associated liposuction, and therefore this is what is called as a lipoabdominoplasty. In mini abdominoplasty, however, what happens is we cut out a smaller amount of skin, just that extra hang, and not cause any umbilical translocation, or that means the navel is kept there in its own space, because the muscle tone is nice, and all the work on the muscle has to be done only below the navel, and the skin requirement, or the skin cutting out of the skin ellipse is much smaller, and therefore the scar is much smaller, and there is aggressive liposuction that can be done. The downtime will be slightly more for a formal abdominoplasty, wherein the patient might hunch up and not be able to walk straight for about 5 to 7 days, maybe even 10 days, but usually after that it settles down. That is because of the tightening of the muscle which has been done, and these are the core muscles, the rectus abdominis, which has been tightened, and therefore that causes this problem. But otherwise, in mini abdominoplasty, about 2 weeks of downtime, and in a formal abdominoplasty about 4 weeks, and you're up and running again. Cheers.